Hi everyone. So today I just came back from today's actually 6 days until my surgery. I'm having surgery on Monday, June 27, 2016 at with Barrington Surgeons at Good Shepherd Hospital in Barrington, Illinois. And today I went for my pre-op with my surgeon and I met the nutritionist. So they gave me a little folder with like a bunch of stuff in it. I'm going to tell you how the appointment went and then what's in this folder. So appointment was at 9 o'clock and they said it was going to take a couple hours, which I expected. So I met with the nutritionist and she gave me a bunch of ideas of of what to look for, how to read labels, what to look for when I'm reading labels. She told me the 5, 10, 15 rule. If you're not familiar or if your surgeons don't use that, you look for no more than 5 grams of fat, no more than 10 grams of carbs, and 15 grams of protein. So that's kind of what they're looking for. So no more than 5, 10, and then at least 15. And then she also gave me a bunch of different options for protein shakes, protein drinks, and she said Isopure and the Walmart brand of protein shakes are good, and Premier Protein. And I did get a sample of Premier and I just put it in the fridge because it says you're supposed to drink it cold. And then she also gave me some suggestions for vitamins. There was a couple that she mentioned, but as soon as she said Flintstones gummies, I stopped listening there because that's what I'm going to be taking. So she said I could take 2 Flintstone gummies every day. And then once I'm on, I think purees, then I can, she gave me a couple calcium options of what I can have. So let me go ahead and just start through this folder and kind of what's in it. I haven't looked through it yet, but I watched her putting stuff in, so it's kind of where we're at. So I got a getting ready for surgery little pamphlet thing. It has some do's. Do arrange for a responsible adult to drive you to and home within 24 and be with you for 24 hours following your surgery. For your own safety, don't take a taxi or any form of public transportation. You have to be with minors. Bring a list of all your current medications. Wear loose-fitting, appropriate clothing. No jeans or pantyhose. Wear closed-heel shoes. No clogs or flip-flops. Oops, I've worn flip-flops every time I've gone into the hospital for anything. So, take all your medicines with a sip of water, which I did ask about that also, and he said yes, do that. Let's see. Call your doctor regarding blood thinners, which he told me since I do have a blood clotting issue. I have the prothrombin genetic mutation, factor 2, I think. Not sure, but I'm gonna have to do shots myself for about 2 weeks after surgery, which I'm not looking forward to because I don't do shots. Don't bring a wallet, purse, or other valuables. Don't have alcohol. Don't smoke. Don't eat or drink after midnight, which actually he told me for the whole day before. Do not shave the operative site. Do not wear contact lenses. Don't bring any children. Limit adult visitors to 2. And then just has like a map and stuff. Oh, it says what to bring. Insurance card, prescription card, photo ID, and a copy of your advance directive if you have one. Don't know what that is. All radiology films, referrals or pre-certification forms, medications, glasses to read and sign consent forms, hearing aid. Children may bring a favorite toy. I want to bring a favorite toy. Crutches or walker. Okay, so that's that. That's kind of getting ready for surgery. Then I have instructions for clear liquids and go lightly. Yeah, that's right, go lightly. I don't know what that means though. Basically this says that On the day prior to surgery, clear liquids may be included, unlimited amounts of water, iced tea, ginger ale, Sprite, 7-Up, broth, chicken or beef, Jello, Italian ice, and apple juice. And that's like chicken or beef broth, not broth, comma, chicken, comma, beef. And then nothing to eat or drink after midnight. That's really all it says. So, and then I have a map of the hospital, and then they gave me a list of days that they have a support group, which is kind of nice. They have it in the hospital that I'm having the surgery at, and it's in the same hospital that my doctor is in. So I will definitely be going to those. It's, let me see. It's on Saturdays from 9:30 to 10:30. It looks like it's on like the 16th-ish of every month. So between like the 16th and 20th. Whatever days the Saturday falls there. Okay, so then I'm going to go over this little packet thing, which the nutritionist gave me. Is nutrition care following bariatric surgery. Oh, and she also gave me a card, which is in my wallet, that says that that you give to people, to like servers at restaurants, if they either don't want you to split something or if they don't let you order the kids meal. It basically says that you had surgery and you can't eat, so that you're allowed to get the kids meal. So that's kind of cool. Okay, so the nutrition care following bariatric surgery. Basically it says beverage guidelines. I'm not going to read the whole thing because there's like 12 pages of this, and yeah, I'm sure if you're having the surgery, I'm sure that you've gotten something like this or will get something like this. If you have any specific questions, you can ask me in the comments below or send me a message. So basically drink 64 ounces of liquid every day, and you have to sip a tablespoon every 15 minutes. So like those little medicine cups, you have to drink half of that every 15 minutes. Half of what you drink, so 32 ounces, should be high protein drinks or strained cream soup. These items should have 15 grams of protein, 10 grams of carbs, and less than 5 of fat. Let's see. You can have Kool-Aid, non-carbonated drinks like Crystal Light, sugar-free Kool-Aid, sugar-free popsicles, and sugar-free Jello, unsweetened iced tea, decaf coffee, and broth. Do not drink and eat at the same time. No alcohol. And no drinking from a straw. She said ever again. So that's cool. Eat slowly. Each meal should take you 30 to 40 minutes. Stomach capacity is only 1 to 2 ounces or 2 to 4 tablespoons, so don't overeat. And they want 60 to 70 grams of protein a day. Let's see. She wants me to take 2 of the Flintstones complete vitamins per day. It says you must take your vitamin and mineral supplements forever. Do not quit taking them, no matter how good you feel. This kind of gets me sometimes because people say like, oh, you're gonna have surgery, you know, you're gonna have to be on vitamins the rest of your life. Well, yeah, but most people are on vitamins the rest of their lives for one thing or another. So, you know, whether it's high blood pressure or just vitamins to have vitamins, like, you know, calcium deficiency, iron, you know, multivitamins. Most people take some sort of something. So being on multivitamins the rest of your life is not really, it's not proper wording. They shouldn't say that just for surgery because it's inevitable, it will happen. And especially if we don't have the surgery, we as in like bariatric patients, then we're gonna be on much worse medicines for the rest of our lives then. To avoid dumping, they said we don't really have dumping syndrome. Just drop that with the sleeve, but she said to avoid it, basically don't eat or drink within 30 minutes before or after a meal, avoid high-fat, greasy foods, lie down when feeling poorly, the food not recommended, 6 to 9 months following surgery. So this is a list of what you can't have for 6 to 9 months. Beef, pork, bread, rice, pasta, instant mashed potatoes, but you can make homemade. Tortillas, nuts, popcorn, stringy vegetables, such as, like you can have the tops of asparagus, but not like the stringy part, and no gum, in case you swallow it, which I don't really chew gum anyways. Okay, so the progression of how the stages are gonna go. So stage 1 is clear liquids, which is gonna be 1 to 2 days while I'm in the hospital. The full liquid is up to 10 days, and that's full liquid is anything that you can put through a straw, but we cannot use straws. Some people can, some people can't. It depends on the surgeon. I mean, there's no right or wrong answer, but I'm just going to do what my specific surgeon told me. But, you know, if someone else's surgeon could have said, yeah, drink from a straw, just don't drink too fast, or, you know, whatever. And also some people can't, they have to wait to get the leak test done in the hospital first, which I don't. The leak test is going to happen while I'm in surgery, so once I'm out and they see that everything's good, then I can start with the liquids when walking right away. I don't need to wait for the leak test. Stage 3 is puree diet, which is, well, I'm sorry, full liquid is up to 10 days after surgery, or after the 2 days of hospital stay with the clear liquids. Puree diet is 2 to 4 weeks, so that's mushies. Stage 4 is soft diet per patient tolerance. So for now, I only have instruction up to stage 3, up to 4 weeks. But because I am going to go back in a month for my monthly check-in with the nutritionist, just to kind of see how things are going. So there's a couple things in here on like how to read a label, kind of like, you know, make sure that you read the serving size and the serving per container, so you don't have, you know, one whole like jar of broth when it's 3 servings and you're only trying to have 1. But so stage 1, it kind of goes through each stage specifically to say what's included, and it has like a sample menu, but sure, the sample menus aren't super legit because they're it's not going to happen. It's just a lot of food for a day. Basically, clear liquid beverage choices include chicken, beef, or vegetable broth, decaf, hot tea or decaf coffee, sugar-free gelatin, iced tea, sugar-free drinks, sugar-free lemonade, sugar-free popsicles. Tips: sip slowly and frequently. Carbonated drinks and use of straws are not allowed. Make sure liquids are sugar-free, and do not force fluids. It's important to stop sipping when you feel full. Then stage 2, which is the home diet, 10 days. Basically anything you can't see through liquids, so non-fat milk, 1% milk or lactated milk, sugar-free, non-fat yogurt, plain vanilla or creamy variety non-fat. Basically nothing with like the chunks in it. Like I know I love the Yoplait peach harvest, and it has like little tiny pieces of peach in there, and can't have that. Supplement beverage, so Premier Protein, Andri, wheat protein, whey protein powder, and Isopure. I cannot speak today. Sugar-free hot cocoa or pudding, strained low-fat creamed soup. And then the tips, let's see. Stop eating or drinking when you feel full. Drink 64 ounces of liquid per day. 60 to 70 grams of protein. Eat 6 times per day. So they basically want you to take 30 to 45 minutes. So have breakfast, snack, lunch, snack, dinner. Right? Breakfast, snack, lunch, snack, dinner, snack. I don't know. Okay, then stage 3 is the purees, and that's which is for 2 to 4 weeks after the first 2 days, then 10 days, then we're on the 2 to 4 weeks. And this is purees, so baby food or pureed meats, sugar-free light non-fat yogurt, plain vanilla or creamy varieties, non-fat Greek yogurt, which I don't like Greek yogurt. I think it tastes like chalk. Eggs, like scrambled eggs or something like that. Creamy peanut butter, which I don't like peanut butter. Melted cheese, refried beans. I don't like beans anyways. Small curd cottage cheese, real mashed potatoes, no instant potatoes. No rice, no pasta, no bread. Sugar-free instant oatmeal. Vegetable juice, sugar-free pudding. Tips: always eat your protein first. It has a lot of the same stuff. Take your vitamins. Stop eating when you feel full. If constipation occurs, you may use Miralax. Exercise 30 minutes each day. Use a baby spoon. Remember to take small bites, which I do have to get one of those. I tried to find one somewhere, but I was not able to find it at the time. And then there's some stuff in here about stage 4 and like the foods that you like, stage 4 and stage 5. but I don't, I'm not going to look at that because that's not where I'm at right now. And then I didn't realize, but in the back here, there is a protein-rich food sources, a list of kind of what has, what has the protein, how much, and the serving size. I thought that was kind of cool. I didn't see this earlier. So the ones with the most, it looks like veggie burgers, the Morningstar Farms or Boca Burgers, 2 or 4 ounce patties have 10 to 17 grams of protein. Cottage cheese, half a cup, has 14 to 15. Not going to read everything. The ones that stand out the most, salmon, skinless turkey, or skinless chicken breast or leg. 3 ounces of each of those have 21 grams each. Imitation crab, tuna or other fish and eggs, 14, 12 grams of protein. So that's pretty much this. Yeah, that's it. Nothing really else to say about that. And then they also gave me this soap. Now, I've been reading and researching a lot on forums, on YouTube videos, everywhere, and I have never even, this never even came up in anywhere I've been looking, but this is a Clorox Healthcare, it's a soap. It's an antiseptic, non-sterile solution. Yeah, so it looks like this. And they gave me this little paper wrapped around it, and I'm going to kind of tell you what it says to do. Basically, the night before surgery, before surgery, it's important that patients take an important role in surgical care to assist the prevention of a surgical site infection. We ask the following instructions be followed to prepare the skin to be as germ-free as possible. So basically, you need to shower with this soap. A common name for this soap is Appt, but any brands are acceptable for use, but they just gave this one. So the night before surgery, wash hair with regular shampoo, rinse hair and body thoroughly to remove any shampoo residue, wash face with regular soap or water only, and then rinse thoroughly with, just rinse your body completely. Turn off the water to prevent rinsing the CHG soap, which is this, off too soon. Apply the soap and leave on for a minute. Pay special attention to the area of surgery. If having back surgery, have someone else help you. Rinse, and then don't use regular soap. Don't use lotion, powders, perfumes. Pat dry with a fresh, clean towel. Put on new sheets. If time permits, for the morning of surgery, shower again with this soap. Use, again, another towel. Don't use the same towel as the night before. So if you have time. If time is limited, only wash the area you have with this. And yeah, that's pretty much it. That was my whole meeting today. Some things that I think are really helpful for before surgery is go on the forums. Go on forums, find someone having surgery same as you, either same day, same week, same month. There's plenty of Facebook groups. I've yet to find one that I want to be in. But there's plenty of groups that want to help people, and that, they have good ideas. Some people might not have, I haven't seen a whole video where someone read through all of the instructions from the surgeon. Some people do different things. Some give you all the stats, some give you just kind of what they're doing, or post-op, pre-op. Everyone's different. Everyone is at different places in their journey, in the procedure. So go into forums and start meeting people. I met a friend who I'm now friends with, and she just having surgery same day as I am, and we're going through the same process, but we're at different steps. Like, my surgeon does not require a liquid diet before, and hers does. So we're kind of going through that, and she's been, this is the second week of her liquid diet, because Monday's surgery and today's Tuesday. So she's halfway done with her liquid diet, and I'm having food funerals. So we're kind of going in opposite directions, but you know, all for the same end result. And you know, it's nice to have someone going through it with you, because then you can, you know, once things do happen, because after surgery, it, you know, it doesn't matter how, like, what the surgeon said to do before. Once surgery is over, everyone's in recovery. So you can recover with people. So, you know, find forums, groups, friends, anywhere. But yeah, so if you have any questions, or if you want to see any other videos, leave that in the comments below. That's all. All right, I will see you in my next video. Bye.